Hi, thank you so much for all the great feedback from RTE's programme last night about the unregulated activity going on in the aesthetic industry. I think for a lot of people the programme was really shocking to see the amount of illegal activity going on with non-medically trained staff doing aesthetic procedures and risking people's health and lives in the pursuit of money. A number of colleagues like myself were on the programme talking about how we need more regulation in this area, and we really need legislation to move ahead. There's been a stall in legislation for a number of years, and we really want that to improve. The other thing I think people can do is obviously just take absolute care. If you're seeking an aesthetic medicine treatment, please see a registered doctor, dentist or aesthetic nurse to look for treatment. Talk to them, think it over, go home if you're not happy to proceed, and really do your research, because some of the patients on the programme last night showed devastating results from botched procedures. And these are not just happening in Turkey or abroad, they're happening on Irish soil as well. So there's two prongs to it. One is we need better legislation and enforcement, and the second is we need better public education. I think what was interesting last night was looking at the way each of us practice in our own lanes. There's procedures I'm very comfortable to do and I'm trained and appropriately insured for, and I stick within my lane. There are procedures I don't do. I'm not a plastic surgeon, I'm not a consultant dermatologist, and I stick to the things that I have really good experience of and training in. And this was really evident last night with people who are not medically trained thinking they can just pick up a syringe of filler or illegal toxin imported from abroad and inject it into somebody's face with no consequences. It's really sobering, it's really shocking, and I know people are price sensitive on aesthetic treatments, but these are elective or planned treatments. They're never urgent like a burst appendix. These are treatments you can think about at home. You need to do research, and although price is a factor, please be careful, because you need to see a medical practitioner who's going to be trained, studying, insured, regulated, and constantly monitoring their own practices and continuing their education. They're going to give you the best result, and they're also going to sometimes turn down people for treatment if they're not suitable. I think what was interesting from the programme as well was we didn't see a lot of good aesthetic work, and I understand the slant of the programme, but I think in good hands a lot of these treatments are life enhancing for patients. So I think absolutely seek out treatments if you think they're going to be appropriate for you. They can have great results, but you're going to get that much more likely if you're seeking a medical practitioner. Interestingly, there was a dentist shown on the programme who was doing illegal activity, and like that, we need to really stick within what we're regulated for and not stray outside that. I'm not a pharmacist, I'm not a dispenser, I don't do jobs that are limited to pharmaceutical expertise and pharmacy regulation. Equally, I think beauticians are great at what they do, but having medical injectable treatments, they should not be done by beauticians. Honestly, they don't have the training or the background or the ability to recognise or to prescribe for complications. So I think within each of us, it's looking at our own areas of expertise and sticking with that. And then please do seek medical experience if you're looking for a treatment. I thought the discussions afterwards were very interesting, and yes, we're all a little bit vulnerable when we seek treatments. So it's gathering as much information as you can. And social media is not always the best way to do that. You need face-to-face consultations with a doctor, dentist or aesthetic nurse to really get an opinion for you that's based on your face, your circumstances, your timeline, your health conditions and your budget, and putting all of that together before you make a decision. I hope that's helpful, and we look forward to more programmes. Take care. Bye.